Welcome to this webinar. My name is Scott Holtstrand, and I am the director of the South Carolina Medical Association Foundation's Patient-Centered Medical Home Project. We have additional information about that project which can be found at our website, scpcmh.org. Again, that's scpcmh.org. And on that website, there will be additional information about the SCMA Practice Innovations PCMH project, including a lengthier webinar that has a lot more detail about patient-centered medical homes, why they are important, what the SCMA's involvement is with them, and how the SCMA is prepared to assist you as you seek to become recognized as a patient-centered medical home. This is a briefer webinar, and it will be addressing one question. That question is your practice eligible for the SCMA's PCMH project? The SCMA's PCMH project is a collaborative effort which will involve a number of different organizations, one of them being the South Carolina Medical Association and our foundation, and also the South Carolina Department of Health and Human Services, also known as Medicaid, and then the National Committee of Quality Assurance, also known as NCQA, which is a accrediting body for patient-centered medical homes. The SCMA Foundation was founded in 1975. So for almost 40 years, this not-for-profit affiliate of the South Carolina Medical Association has been encouraging worthwhile social and professional activities in the field of medical education, medical research, and the delivery of medical services. So for 40 years, the foundation has touched the lives of medical students, physicians, families, and many members of their communities. And this project in particular, the South Carolina Medical Association Foundation, is providing free consulting and coaching services to South Carolina primary care practices that are interested in being recognized by the NCQA as a patient-centered medical home. The foundation is able to provide these very valuable coaching and consulting services free of charge to eligible practices. And the reason for that is we have received a grant from the South Carolina Department of Health and Human Services to provide these services. I'm going to talk first about the requirements for NCQA so that you can see if your practice is eligible to be recognized as a patient-centered medical home by the NCQA. And then after we talk about the NCQA requirements, we will then talk more specifically about the requirements for this Foundation PCMH project. And by the end of this webinar, you should be able to know with pretty good certainty whether or not your practice would be eligible for this assistance program. First, though, let's talk about the NCQA requirements, because if you are not eligible for this, then you will also not be eligible for the Foundation's project. But I will say that even if you're not eligible for the NCQA Patient-Centered Medical Home, the NCQA also offers a patient-centered specialty practice which your practice may be eligible for, and we hope in the future to be able to provide assistance for that process as well. So basically, if you ask this first question, it really will get you a long way towards determining if you're eligible. And it's this: is my practice a primary care practice? The Patient-Centered Medical Home from NCQA is developed and designed for primary care practices only. And they define primary care practice as practices that provide first contact, continuous, comprehensive, whole person care for patients across the practice. And whole person care includes the provision of comprehensive care and self-management support, emphasizing the spectrum of care needs, such as routine and urgent care. It also includes mental health, and then advice, assistance, and support for making changes in health habits and making healthcare decisions. Preventative care is also a key component for patient-centered medical homes. So if your practice is a primary care practice that is providing this first contact, continuous, comprehensive, whole person care for patients across the practice, it is likely that your practice would be eligible for the NCQA patient-centered medical home recognition. Generally, this will include family physicians, general physicians, pediatricians, and internal medicine. These are the primary types of practices that are generally eligible for the patient-centered medical home. Excluded from eligibility are urgent care practices that do urgent care only, and that goes back to the definition. It needs to be continuous and comprehensive and not just address urgent care, but also routine, long-term, and preventative care, which in most cases urgent care practices do not provide that kind of care. So if you are in family or general medicine or pediatrics or internal medicine, it is likely that your practice will be eligible. A lot of questions though come up about whether OBGYNs, cardiology, oncology, endocrinology, and others that provide some measure of primary care, whether or not they are eligible. And some of these practices may be, and the question is that practice providing whole person care and meeting other elements that we've just described for most of its patients? And in this case, at least 75% of its patients. So for example, if a cardiology practice is providing this whole person, first contact, continuous, comprehensive care to at least 75% of its patients, then it can be eligible for PCMH recognition, even though it's not a traditional primary care practice. And the practice must provide primary care if you are in the normal category, like for family and general medicine, pediatricians, and internal medicine. You must provide primary care for all of the patients in your practice, not just select patients. So for example, if you're a pediatric office, and let's say you are primarily actually in urgent care for kids, but you did provide primary care for some subset of those children, that would not qualify. You would need to provide primary care to all of your patients in your practice. Just as an example of how NCQA has applied this requirement to a practice that might not be considered a normal primary care practice, in the past they have recognized clinics that specialize in care for patients with HIV and AIDS because the practice demonstrated that they actually served as the primary care provider for those HIV/AIDS patients. In contrast, most oncology clinics only serve as a principal source of care for one aspect of that patient's care, namely the cancer care, and don't necessarily provide the comprehensive care that is required to be eligible as a primary care practice. A practice for NCQA is defined as one or more clinicians who practice together and provide patient care at a single geographic location. And practicing together means that for all of the clinicians in the practice care team follows the same procedures and protocols. Medical records for all patients treated at the practice site, whether paper or electronic, are available to and shared by all clinicians. And then the same systems and procedures support both clinical and administrative functions. And examples of those are scheduling or treating patients, ordering services, prescribing, follow-up, and things like that. Now, all the clinicians is underlined because in order to be eligible with the NCQA, just as an example, let's say you have a family practice and you have 10 physicians in that practice, but only 3 of them want to be a patient-centered medical home and the other 7 don't want to. That kind of practice would not qualify. You have to have all of the clinicians on board and agreeing to become a patient-centered medical home. Here's some examples of eligible primary care practices that would qualify for NCQA's recognition program. The first you can see on this list is an incorporated group of 3 clinicians in an office site who use the same systems and staff as we've already described. And that's more of an obvious example. But you could also have, if you look at the second item, an individual clinician who may be sharing an office with other clinicians, maybe not, who maintains his or her own systems. So you could have a solo practitioner who is renting space from another practice who may not be a patient-centered medical home, but they could set up their own individual patient-centered medical home within that practice. The third item is a group of clinicians at one location that is part of a larger medical group with several locations. And we'll talk a little bit about multi-site recognition, and there is a recognition for multi-site groups. But really, NCQA focuses on each location. So let's say you have a practice that has 5 locations. All 5 do not need to be a patient-centered medical home. You could actually have 2 or 3 of your locations become recognized as patient-centered medical homes, whereas 2 others, for whatever reason, may not receive the recognition. If you look at the fourth item, and this is kind of what we've already been describing, an eligible practice is one within a multi-site group, and that's defined. A multi-site group is defined as 3 or more practice sites that use the same systems and processes, including an electronic medical record system that is shared across all practice sites. And again, we'll talk a little bit more about that in a minute. And then finally, you can have a subset of primary care clinicians within a multi-specialty practice. So if you're in a multi-specialty practice, but you have a subset of physicians who do provide the continuous, comprehensive, whole person care that we've already talked about, that subset can be recognized as a patient-centered medical home. This now describes, we've talked about eligible practices. We want to now discuss briefly who are eligible clinicians. And remember, we've already said that you can't have a split group where 5 of your family physicians decide to do this and 5 decide not to. You have to have all of your primary care clinicians on board with the patient-centered medical home. And how you determine who is eligible for this is you ask, can that clinician be chosen as a personal clinician? Or from the other side, does that clinician have their own, or do they share a panel of patients who can select them as their primary care clinician? And I say clinician because if you have PAs or APRNs who either share a patient panel with you, or some practices may have APRNs or PAs who have their own patient panels, those clinicians are also eligible to be a part of the patient-centered medical home. Physicians definitely qualify, and then APRNs or PAs, they qualify if they either share or have their own panel of patients. I've highlighted the last item on this list because, again, I want to emphasize that all eligible clinicians that practice together at a practice site that apply, they must be included in the application. And this is what we've already described. You can't have some that aren't on board. The whole practice needs to be on board. If you look at some of these other items, some of you may have residency groups that practice in your practice, and that group can be a personal clinician if they have a patient panel. And so there are other clinicians that are eligible, but traditionally it is the physicians that are part of the primary care practice. Let's talk briefly about multi-site eligibility. And what I want to focus you on is the highlighted section that has the red box around it at the bottom. In order to be eligible as a multi-site, you have to be able to answer these 3 questions in the affirmative. And the reason why you would want to apply as a multi-site is because there are some streamlined options that are available to you where you don't have to do as much of the work for each practice. You can actually be recognized for a lot of the elements of patient-centered medical home at the corporate level, and then each site doesn't have to duplicate the work that you've already done at the corporate level. So it does really streamline your effort to be recognized. And the 3 questions are, 1, can your organization sign one program agreement that would cover all of the sites applying for recognition? If you answer that yes, then you ask this: at least for a minimum of 3 months, and currently, are all the practice sites applying for recognition using in the same way either a practice management system, registry, or an EHR to document patient care for administration and billing? And if you answer yes to that question, you have to ask the third, which is currently and for a minimum of 3 months, have all the practice sites applying for recognition operated under the same policies and procedures? And if this is the case, if you answered yes to all 3 of these, you are then eligible to apply as a multi-site. There's a lot of questions, though, about whether 2 sites qualify, and the answer to that is no. It is a minimum of 3 sites. If you have 2 sites, both of those sites can apply individually for the patient-centered medical home status, but they do not get the streamlined application that a multi-site practice would get. This slide contains the 6 standards that are required of practices that are applying to the NCQA to be recognized as a patient-centered medical home. Each of these 6 standards have a number of elements and factors that need to be met in order to be recognized as a patient-centered medical home. The additional webinar that is on our website, and again the address for that is scpcmh.org, or you can use scmapcmh.org. That website contains an additional webinar that goes into a little more detail about these standards. But just to say briefly, each of these standards has a certain point level that is associated with those standards. And as you meet these standards and meet the requirements, you get points for meeting those standards. And then the NCQA has 3 levels of recognition. There's a level 1, level 2, and level 3. Level 3 being the hardest and most prestigious, and obviously the most points. But if you just look briefly at this slide, what the patient-centered medical home from NCQA focuses on are these 6 on the left. Those 6 standards are what they want your practice to meet. And what I say to a lot of practices is that you're likely doing a lot of these things already, and what it just takes to be recognized is documenting those so that you can prove to NCQA that you are already doing what they have called their standards. The first one is all about enhancing access to care and continuity of care, and that involves things like your office hours and whether or not patients can select a personal clinician and other things like that. The second standard involves what is called population health, and it really just requires you to keep track of certain conditions and data and information about your patients, and then using that information that you have about your patients to remind them of care that they need, to give them access to materials about their conditions. All sorts of things related to population health are in standard number 2. Standard number 3 is all about planning and managing care, and it's specifically for conditions that you as a practice choose to focus on. So let's say you're a family practice. You would choose maybe to focus on diabetes care. And if you choose that, you would have a subset of your patients that you would work to plan and manage their care, and that's what Standard 3 is all about. Standard 4 is about self-care, and that's where you enable patients to care for themselves at home or wherever they are. And it allows you, or it helps you to think through the kind of resources that you can make available and assistance that you can make available to your patients so that they, once they leave your office, don't forget what they're supposed to do and take proactive steps to take better care of themselves. The 5th standard is all about tracking and coordinating care. This is about tracking lab and imaging tests that you have, that you order. It's about prescribing electronically. It's about making sure that your referrals go through and that you are communicating not only with the specialists that you refer to, but also with other facilities where your patients may be receiving care. And then the 6th standard is about measuring and improving your own performance. Basically, what you do to meet this standard is you look at your own data and you look at your own practice and you decide places where you'd like to improve, and you set goals, and you then measure to see whether or not you're achieving those goals. And these goals are more based around patients that have certain conditions and trying to help those patients improve in their health. This is a really brief summary, But as I've said, this webinar is more about whether or not you're eligible. There's other information on our website and a more lengthy webinar that can describe a lot more about the NCQA Patient-Centered Medical Home. Well, now that we've talked about whether or not you're eligible for the NCQA process, and let's assume that you are, you now need to determine is your practice eligible for the SCMA Practice Innovations PCMH project. And this slide contains some of the assistance that we are preparing to provide to you as you seek to be recognized by NCQA. And as you just saw on that last slide, there are a number of things that you're going to be asked to do, and not just do them, but record the fact that you've done them and be able to prove that you've accomplished these standards in a way that NCQA can recognize you. Well, what the foundation is prepared to do is help you with that whole process from start to finish. Even if you've never even thought about becoming a patient-centered medical home and now you're interested, our foundation is prepared to help you learn more about it, actually make the changes that need to be made in your practice, and then help you with the actual application process with the NCQA. The assistance that we provide is very wide-ranging. It can be from square one, where you've never thought about it and now you're interested and want to get on board, or maybe you know a lot about it already but just need some additional assistance. We're really here to provide whatever level of assistance you require and whatever you need. And if you feel like you've got pretty good control of your project but just want another set of eyes to come and take a look at the new policies and procedures you're implementing, or maybe how you've answered certain questions, we're ready to provide that level, but also even down to coming to meet with you in your practice and sit down with you and your practice manager and maybe other clinical staff who are involved and help you map out a plan and then stay accountable to that plan. So really what I've described is the coaching and consulting on-site services that we're prepared to provide. But also you'll have access to an SCMA PCMH consultant via email and phone throughout the week if you just have questions that pop up as you're working through the process. For some practices that need more intensive help, we're going to have weekly phone conferences and weekly emails about the PCMH project and the process that the practice is going through. Also, you're going to have an opportunity to learn best practices from dozens of other practices that we're working with. So, for example, if a pediatric practice comes up with a great way to handle after-hours access, we would want to share that with other practices so that we can learn from each other. And again, because of a grant that our foundation has received from the Department of Health and Human Services, all of these services are complementary. And these are quite valuable services out in the marketplace, so I encourage you to take advantage of them. Well, how do you know if you're eligible? Well, these requirements on this slide give you a good indication to whether or not your practice is eligible for our program. One thing that we're really trying to focus on are areas in the state where there is a lot of disparities in care, and also where there are a number of Medicaid patients in your patient panel. And so one of the things that we require is a minimum of 1,000 Medicaid patients that are on your practice panel. And now you may be thinking to yourself, well, I have 800 or I have 500, but they're really needy and I serve a lot of other patients who are maybe uninsured or need a lot of extra care. Well, we really have that minimum 1,000 in there, not as a strict requirement, but really that's kind of what we're looking for. But if you look at the bottom, there are special eligibility circumstances. So if you don't have 1,000 Medicaid patients on your practice panel, but you do have other special reasons why you may be eligible for this assistance, please apply and please get in touch with us because you still may be eligible. We also are asking having at least one physician who is leading the effort in your practice. At the SCMA, we believe that physician leadership is key to the implementation of a patient-centered medical home in your practice. And so we ask to have at least one, but of course we'd love if all of the physicians in the practice were leading this effort and they buy into the patient-centered medical home. We expect that there will be other clinicians and other staff in your practice that will be working on this as well. We also require, there are 2 agreements that we ask you to sign. One is a business associate agreement, and this is really more for your protection because we may have inadvertent access to some of your protected health information in your practice. And if that would happen, we would want to make sure that we are protecting your patient information. We take that very seriously. So we are willing to sign, and we actually already have a form where we would sign a business associate agreement for HIPAA reasons to protect any patient information that we may have inadvertent exposure to. We also will have a brief letter agreement that we will send to you that basically agrees to a couple terms and conditions with respect to the project. Also, we're looking for practices that are at the beginning or just into the PCMH recognition process. So if you're already at level 3 recognition with NCQA, you wouldn't need us, or even at level 2. But if you are just starting to apply, or maybe a few months down the road, or maybe even a year down the road, just haven't made progress for whatever reason, then we are here to help you be recognized by the NCQA. We also require that you have a physician or staff member as a primary contact for the project so that we can have ease of access to you so that we can make sure that any information that we need to get to you can, in fact, get to you. Now, the Department of Health and Human Services has already stated that they will pay practices that apply for patient-centered medical home status with the NCQA a 50-cent per member per month payment in addition to their typical Medicaid payments. So if you have Medicaid patients, and likely you will if you're a part of this project, then just for applying, just for trying, DHHS says we will give you 50 cents for each Medicaid member on your patient panel per month. And now if you achieve NCQA PCMH recognition, as you can see from this slide, that payment goes up to $2 per member per month. And so that is one motivation that you may have for getting into the patient-centered medical home, is that it does afford you new opportunities and new revenue streams from payers. HHS already has said they'll pay what is on this slide, but I know that other payers in the state are interested in setting up various payment structures for the patient-centered medical home. And if you've been following anything with the Medicare payment reform that is going on at the U.S. level, patient-centered medical homes are first on the list for receiving additional payment incentives from Medicare. So there's a lot of talk and a lot of action out there right now with respect to patient-centered medical homes and new payments. And these payments right now, at least, are in addition to your normal fee-for-service payments. Well, you may be asking, how much does it cost for me to apply to the NCQA for recognition as a patient-centered medical home? Well, there is an $80 application fee, and what that does is that gives you access to the survey tool. And the survey tool actually has all 6 standards that we've already talked about. And that is where you put in your information to how you have met those standards. So that's $80 for that tool. Once you are ready to apply for recognition status, there's an additional fee. Typically, that's a $550 per physician fee. But if you do this project through the SCMA Practice Innovations, you receive a 20% discount. So it would be a $440 per physician fee to apply for patient-centered medical home recognition status. Now, multi-site pricing varies. It depends on how many sites that you have, and you also get a 50% discount on clinician fees because your site fee is actually a little bit higher. So that is all the outlay that you will have to make in this project, is $440 per physician plus an $80 application fee. And then the multi-site fees, they're a little bit different, but it's about the same once you average it out. This slide shows why that application fee, I think, is definitely doable for any practice, even if your margins are really small and you don't have a lot of extra funds to spare for something like this. This slide, what it contains is, on the left-hand side, far left-hand corner, it's number of physicians in a practice. And then it's the fees that would be charged for NCQA, including that $80 fee and then the $440 per physician fee. And then the last 4 columns are what HHS alone would pay you for 12 months for either applying for NCQA status or when you achieve level 1, 2, or 3. Now the assumptions on this slide, and obviously this would be different if you had lesser or more patients, is that each physician in the practice has 750 Medicaid patients on your panel. Now that would obviously change if you had more or less, but this is just a number that we've used. So just if you look as an example, let's say you've got 5 physicians in your practice, each of them have 750 Medicaid patients. Well, the total fees to apply would be just over $2,000, $2,280. But just to be in the application phase, and we'd assume that you would get to at least level 1 with our assistance. Let's say you hit level 1, you'd have $45,000 for the year from Medicaid alone, and this doesn't include other payer opportunities that you may have. So this is a really good deal. You've invested just over $2,000, but in addition to what you've received from fee-for-service, you also would receive $45,000 extra. And some of these costs may be you may need to hire someone new, though typically when you're starting out, we don't recommend hiring a new employee, because one thing that happens when you start looking at the NCQA requirements and patient-centered medical home is you can actually streamline the way you do business. And so it's likely that someone that may be focused on other areas can actually take some time and focus on what you're doing with patient-centered medical home. So these are great payment boosts that you can receive. It's a new revenue stream that is available to you. And this, I think, makes any application fees that you have very doable. And so we encourage you, if you have watched this webinar and you believe that you are eligible as a practice, we encourage you to apply to the SCMA Practice Innovations Program today. And if you have questions, you can contact me. My email address is right there. It's scotth@scmedical.org. Please feel free to email me with any questions you have. And if you want to apply, or if you have questions still about whether or not you're eligible for our program, please email me and I can answer those questions for you. Thank you so much for listening to this webinar today. And again, there is additional information on our website, which is either scpcmh.org or scmapcmh.org. Thank you for your time today, and I look forward to your questions.